Hello, everyone. It's Friday, December the 4th. This is not a good number, but to tell you the honest truth, the way it's been going, it's surely a little bit better. You know, when you announce 40 and 43 deaths, and even though that one of them was over a holiday period, but we've got 21 people that have died since Wednesday, and I don't know how you celebrate 21 people dying, but you know, the only thing I can say, it's a heck of a lot better than 40. I want to read all these to you, as I always do. I want you to think, you know, at this holiday season right now, of all things, these people are going to be tremendously missed, and you got to really bear down with your prayers and remembering these great people as not numbers, but great West Virginians. Our 779th death is an 86-year-old male from Berkeley County. Our 780th death, a 56-year-old female from Berkeley County. Our 781st death, an 83-year-old male from Marshall County. Our 782nd death, an 81-year-old male from Marshall County. Our 783rd death, a 91-year-old female from Boone County. Our 784th death, a 77-year-old male from Hancock County. Our 785th death, a 51-year-old male from Wood County. Our 786th death, an 87-year-old male from Mineral County. Our 787th death, a 79-year-old female from Mineral County. Our 788th death, an 85-year-old male from Greenbrier County. Our 789th death, a 73-year-old female from Cabell County. Our 790th death, a 53-year-old female from Hardy County. Our 791st death, a 72-year-old female from Lewis County. Our 792nd death, a 64-year-old male from Marshall County. Our 793rd death, a 55-year-old male from Kanawha County. Our 794th death, a 65-year-old male from Berkeley County. Our 795th death, an 82-year-old female from Mingo County. Our 796th death, an 89-year-old male from Brooke County. Our 797th death, a 95-year-old female from Putnam County. Our 798th death, an 85-year-old female from Putnam County. And our 799th death, a 94-year-old female from Ohio County. Let me just stop and just say this. You know, when I look down there and like on Wednesday and I see a 25-year-old that's died, or a 56 or a 51-year-old that's died, you know, a 53-year-old, you know, it really hits home, because these individuals, it seems like, had so much life in front of them. But then when you really step back and think about it, when a 64-year-old dies, or a 70-year-old dies, or an 80-year-old dies, or even we lose someone in their 90s, you know, this life is so short, and to be cut short by this terrible pandemic is a shame. And really, the wisdom that all these people have is just unbelievable. You know, like I said over and over and over, you know, I'm 69 years old. I feel like I'm 30, you know, and my brain and everything, you know, my knees don't work too good, you know, but really and truly, I don't feel like that it's time for me to die. And all these people, I'm sure, for the most part, are in that boat. And so they've given so much. There's so much more they could give, and it's cut short, and their loved ones are hurting. So absolutely, just reach out in your prayers to all their loved ones and these great individuals. And I've got a letter that came into us, and I want to read this really quick to you. It's really short, you know, and but this letter came as just from a constituent. This letter came to my office on Monday. It says, "Dear Governor Justice, thank you for reading the list of people who have passed away in your press briefings. Today," I guess this was Monday, "you listed 2 of my friends, person 722, person 723. I have known them for 20 years, and they were a remarkable couple. They had been together since they were teenagers, and they died within hours of each other after contacting this virus from a family member. Thank you for honoring them, and I will continue to pray that the people of West Virginia will follow the guidelines. These senseless deaths are devastating." I don't know how it makes it more clear that we need to honor these people by reading their numbers and their counties. It's just really sad, really, really sad. Okay, our positive numbers in the last 24 hours, our new positive cases are 1,147. In the last 7 days, we have 7,129 new positive cases in West Virginia. Our daily positivity rate is 5.37. Our cumulative rate is 3.76. The number of active cases, we almost have 18,000, and we almost have 34,000 that have recovered. We have a record high of 632 patients hospitalized in West Virginia and 169 that are in the ICU units. That hasn't risen much, but it is still the highest. Yesterday in the state of West Virginia, we tested almost 17,000 people. Now that's a big, big, big number. Remember, we were struggling to get 3,000 people tested. We tested almost 17,000 yesterday. Today, our reproduction number is at 1.08. It's the 25th best in the entire country. And so what does that tell you? It tells you that our country is really on fire. We have 13 red counties. There's too many to just read, county after county. We have 13 orange counties. We have 26 total counties that are red or orange. And at this time, that's for all practical purposes, half of the state of West Virginia. Now, again, if you're 65 years or older, you got significant health conditions, you're right in the crosshairs of this terrible disease. You've got to listen to me. You've got to let someone else run and get your groceries, or think about skipping church for a little while and getting your services online or as best you possibly can. You've got to listen to me, because really and truly at the end of the day, if this thing grabs a hold of you, it just will not look good. So, nevertheless, I want to just say this. If you've got 13 red counties, 13 orange counties and everything, and someone would say, well, let's close the bars in a county, or let's close our restaurants in our indoor dining, let's do those kind of things. Well, pray tell me how that is going to make an absolute significant impact. And if it doesn't make a significant impact, it's going to make an impact on the other side of the ledger, and it's going to hurt us on the other side. We're looking at everything nonstop, and we're listening to the experts beyond belief. We have got this in a better way in West Virginia probably than anybody in the country. And yet it's still tough, and I know it's tough. We're going to continue to watch, and no matter what we have to do to stop this, we'll do. But I caution everybody, and I just tell you just this. we're on a short fuse here. We've got a miracle vaccine on the way, we think. And I'll talk to you a whole bunch about that in just a few minutes. But all we've got to do is just make it a few more weeks, a very, very few more months, and we'll absolutely crush this terrible killer with the vaccine and the hope that's on the way with that. Please protect yourself now. Wear your mask and do any and everything you possibly can do to not let this crawl right in your life as well. Now, another thing that we really need to stop and pause and let me just do this for all West Virginians. You know, I've said it over and over, I'm a Christian through and through, and I really believe that with all in me, and I am not, I'm not very versed and I'm not very professional at saying a prayer. But we had a police officer that was shot in the face, and absolutely, she is now passed. And it's just a crying, pitiful shame. You know, Cassie Johnson. You know, it's just so sad at this time, especially at this time. So let me just say a real quick prayer. You know, and I'd like all of you to join in with me, but if you could just bow your head just for a moment, I won't take long, but dear Heavenly Father, you know, we don't understand what this terrible killer that just takes so many of great West Virginians' lives and is sweeping across this nation. We don't understand why. We know there's a bigger plan. And we know that our only hope to get through this is you. But also, we don't understand losing Cassie Johnson. We don't understand that level of violence towards people that are heroes and they're trying to help in every way. What an incredible, incredible lady. And what an incredible hero for the state of West Virginia and our nation. So please, please, throw your arms around her as I know you have, and hold her really close to your heart as well as all these that we've lost. And please, please, please throw your arms around all these people's loved ones, and especially Cassie's. So I only pray these things in your name, and I know you'll get us through this, but thank you so much for all you do and all your blessings each and every day. Amen. Let me say this too. The flag lowering in West Virginia for Cassie will commence on the day of her services and will end at sundown that day. So, and in addition to that, I'm proud to know that, you know, we have an emergency responders survivor benefit in the state of West Virginia that's $100,000. And, you know, 100 million, 100 billion, 100 trillion, this family would gladly give if we could have Cassie back. Well, I truly believe she is back, and she's back in a better place than we could ever have here, but I know how much this family hurts. And so I'm proud we have things in place like this, but my gosh, I know that's got to really be tough. Again, Cassie, thanks, and we love you, and we really, truly, truly know that you're a hero for West Virginia forevermore. Just a few minutes ago, you know, I've got one other thing that I'd like to do, but just a little bit ago, an hour ago or whatever, you know, we had a Board of Public Works meeting. Started at 10 o'clock, you know, and I kind of chair the meeting and everything, and we had a lot to discuss. We had, you know, things such as lawsuits and property transfers and public utility assessments and bonds and everything else like that we go through. You know, in that meeting, there was a gentleman in the meeting, and he's our state treasurer, John Perdue. And John, I just want to take just this moment to to thank John for 23 years as our treasurer. It's amazing, amazing. He was elected first in 1996 and was sworn in 1997. He served 6 consecutive terms. A good man that cares an awful lot about West Virginia, you know, and so today, at least, you know, I was able to give him the Distinguished West Virginian Award, and so all of us, you know, should congratulate John Perdue, and right there we are giving that. I can't believe John and I are about the same height. Looks like I'm a little bit heavier, and it's kind of nice that we've both got the same color hair. But nevertheless, John, thank you so much. Also, on Wednesday, I announced a promo in regard to our hunting and fishing licenses, and West Virginians can now purchase that 2021 hunting and fishing license and will be entered into that prize drawing. Anyone who purchases a 2021 license in the month of December will automatically be entered into that drawing. That's, you know, for 2 lifetime hunting license, hunting and fishing license in West Virginia. You know, one is a 4 vacation. You know, you have 4 vacation getaway spots at our state parks, and there's 8 really nice gift bags and everything with all kinds of neat stuff in it and everything that they're giving away. You know, it's not going to cost you a dime. You know, you just need to go ahead and get your hunting and fishing license. We're really, really proud, you know, that West Virginia, for the first time in the last 6 years, we had more people enjoy our streams and our woods and buy purchase hunting and fishing license than we have in the last 6 years. And I can't tell you enough how wonderful this state is to be able to go out and enjoy the outdoors. Now, let me just stop just 1 second and just say this. The good Lord has blessed me with the ability to be able to go anywhere in the world if I wanted to go and go fish or go hunt. I don't go anywhere. Very, very, very seldom do I go anywhere. And as far as going outside of this country, you know, I could go to Argentina and I could catch a monstrous brown trout, or I could go to Africa and go on a safari. Not for me. You know why? Because there is no better place in West Virginia. If you go and you enjoy our woods and our streams and the beauty, it will touch your soul. It will absolutely change your life, and it'll touch your soul. You know, the other day I sit on here, and people may giggle at me for saying this, but it's honest to goodness truth. If you could see a bluebird or scarlet tanager and watch it, and you could see the brilliance of the red on a scarlet tanager. You may think that I'm silly in saying this, but I can tell you a lot of us may know what a scarlet tanager looks like. But until you really experience the woods and the nature and the streams of West Virginia, you're not really seeing what a scarlet tanager really looks like. It's a beauty that will touch your soul, as so many different things. The catching of a little native brook trout, and the beauty of that little native brook trout, to me, surpasses the biggest tarpon that you could possibly catch in whatever ocean it may be. Do it. Buy your hunting and fishing license. Be entered into this drawing and everything. It absolutely will help all of us and everything, and if you can get out into the woods, it will touch your soul. Now, I've got a lot on vaccine that I need to go through. I want you to pay really close attention and everything, because there's a lot of people that are, you know, wondering what will happen and everything. I'm going to read all this. I'm going to go through it as best I possibly can. The COVID-19 vaccine will protect us from this virus and save lives. Based on months of clinical trials, COVID vaccines that have received the FDA approval and have met rigorous and scientific standards will be coming your way. Clinical trials with tens of thousands of people have demonstrated that the vaccination is highly effective in preventing COVID and cause no, did you hear this? no serious safety concerns. The COVID vaccines will not give you COVID-19. Getting yourself vaccinated will improve the health and well-being of our communities and get our economy moving again. Getting vaccinated not only protects you, but the people around you, particularly those at risk, that have a severe illness. It is vital that each of us continues to do our part to prevent the spread of this virus. Stopping a pandemic requires using all the tools we have available, and the vaccination is just one of those tools. It is important that we continue to wear our face coverings and keep social distancing. Now, understand how this vaccine is going to be so effective. It stops the chain reaction. Basically just that. In order for this terrible killer to keep going, it's got to be passed from A to B to C, from me to somebody to somebody to somebody. If the chain is broken, then the killer pandemic dies. The wearing of our mask helps the chain be broken. The increase in our testing helps the chain be broken. But the vaccine will be the big thing. The vaccine supply, there will be a limited supply of COVID vaccine when it first becomes available, so the vaccine will be distributed in phases based on risk for contacting COVID. Our supply will continually increase in the weeks and months that follow. Our goal is for West Virginians to be able to easily get the COVID vaccine as soon as the large quantities are available. When the vaccine is available in larger supply, the distribution in phase 2, it will become available to all in the general public. Now, let me just comment on this just real quick. Here's how I see the whole thing coming down. The first amounts of vaccines, what do we really need to do and look for first? First and foremost, we've got to protect those that are running our critical health units. I mean, if we lose the people that are running the show, the nurses, the docs, all the people that are running the show at our critical health units, we're in real trouble. Then we need absolutely to be doing the same thing throughout, our hospital systems. We need to be doing the same thing with our first responders and all those, absolutely. Then we need to target where this killer is really eating us alive. 47% of our deaths are from our nursing home or assisted livings. So what we need to do is we need to be able to first and foremost make sure that our staff is all vaccinated, and then secondly fall right in with our elderly. And then it all just falls in place, whether it's our teachers or it's the most, it's people above a certain age that have certain level of illnesses and everything. And then what will happen is just this. In the first week, X number of vaccine will come in. I think it's a little, right now, and we're pushing to get more and more and more, but it's just short of 20,000. And then every week thereafter, it's 21,000. But in addition to that, Moderna then is going to come online, and we hope that these numbers will escalate very substantially, very quickly. From the standpoint of our general population and everything, this will not be a wait until the middle of July. I am very hopeful that this will move so quickly, that what will happen is possibly even by the middle of March, we'll be able to vaccinate almost everyone. Now that is ambitious, and that's Jim Justice's thinking. That's not the CDC's necessarily thinking, because they're padding themselves and giving themselves a little extra time. But I think if we push and push hard enough, we'll be able to be out with the general public, and absolutely we'll be slowing this thing down like really soon. And today I'm announcing the initial allocation for the COVID vaccine. We believe that we have reliable estimates of how many doses we're going to get. I've just been through that with you and everything, and we do not know yet, that we will receive, what we will be receiving in 2021. Pfizer's initial allocation of approximately 60,000 doses with a weekly ordering cap of somewhere around 16,000, 17,000 is kind of floating around. We anticipate an allocation from Moderna, and 1 week after the Pfizer announcement, the initial allocation will be 26,000 with a weekly ordering cap of somewhere between 3,000 and 5,000. So we'll be up somewhere with the 16 and the 5, we'll be up somewhere north of 21,000 a week in the beginning stages. The initial stages of the vaccine distribution is broken down as follows with the recommendations from the CDC. And that is, first is healthcare workers. Second is long-term care staff and residents. The next is community infrastructure and emergency response, public health officials, and first responders. There are over 100,000 West Virginians who fall into these categories. Our target receipt date for the first doses is December the 15th, but that's an estimate dependent upon the approval by FDA. Our plan is to eventually scale to additional hub locations in the state with approximately 250 administration sites throughout West Virginia. There'll be 2 doses of these vaccines. One, the Pfizer vaccine, you have to take 21 days from the day you took the first dose. The Moderna vaccine is 28 days from the day you took the first dose. I have been told by our medical team and experts that upon taking the first dose, there will be significant or some protection and some significant positiveness of taking the first vaccine. Taking the second vaccine is what really wraps this thing up to a 95% prevention. The vaccines are not interchangeable. So if you get to Pfizer, you've got to take the Pfizer in 21 days. It is extremely important to receive both doses of the vaccine. If only one is received, immunity cannot be guaranteed in any way. It will help you, but it won't get you to where you need to be. I will update you every time I have a press briefing. Our numbers will change, and when they do, we will announce additional phases and additional groups that will be receiving the vaccine. Okay, last thing on the vaccine, because the vaccine probably is the most important of all right now. You cannot get COVID from taking the vaccine. The vaccine has been proven over and over by thousands, tens of thousands, and lots of work from our FDA that it's safe. I'll take mine right in front of everybody, if that'll help you. I see that there's 3 presidents, President Clinton, I think President Bush, and maybe President Obama have all agreed they'll take theirs right in front of everybody. You need to take the vaccine. To date, there are no serious safety concerns that have been reported by an independent data and safety monitoring board overseeing phase 3 trials of the Pfizer and Moderna mRNA COVID-19 vaccines. Both vaccines met the safety requirements outlined by the FDA. If you are not being tracked by receiving, you are not, and the other thing, people, I don't know what in the world, people can come up with any kind of thought. But some people believe that if they get the COVID-19 vaccine, the federal government is tracking them. You're not being tracked by the federal government if you get this vaccine. The vaccination planning has been underway since August, with various task forces meeting to discuss this each and every day. And this distribution is going to be like something you've never seen. Our wonderful military is in charge, and they will absolutely do a job like we can't imagine. Our National Guard and medical experts are some of the smartest people, not only in West Virginia, but in this entire country when it comes to planning and distributing, something like this. Wearing a mask and keeping your social distancing still continues to be important even after receiving this vaccine. There will be limited doses available initially, and because people will be vaccinated in waves, it will take time to vaccinate enough of the population to stop this spread. So in other words, what's going to happen is there will be initial limited doses. They will be vaccinated in very, very quick order in a wave, but since it is just a limited dose, it will still be imperative for some period of time that we do all the things that we've been preaching, wearing your mask and keeping social distancing and so on. Additionally, we still don't have how long the immunity will last. No one really knows that how long, because this is we've never dealt with anything like this. No one really knows that this immunity vaccine is going to last 6 months, 2 years, your lifetime. We don't know that because we've never dealt with it. But we absolutely have really high hopes. And so again, until you and the people who live in West Virginia, are vaccinated, the absolute best defense that we have, wearing a mask is still absolutely critical and mandatory, and I know it's inconvenient, but we're on the downhill now. We're on the downhill. If we can get vaccinated and not be scared to death to be vaccinated, and we can do that when over and over and over, I'm telling you, everybody's telling you, no significant side effects, none with anybody. Now, we got to get vaccinated. We got to get vaccinated, and we got to get vaccinated quickly to stop this thing. We're pushing more and more and more to get more and more and more vaccines here. I had a meeting yesterday with all the players that were working this, and my message to them was to tell the powers to be at the federal level and everything that the governor down here was absolutely just fit to be tied, and meaning that the governor wanted more and more and more vaccines. Everybody does, but we're the oldest state, and we're the absolutely most critically ill state in many ways. So we're pushing, I'll promise you, as hard as we possibly can. I want to go to General Hoyer and then to Dr. Marsh, but at this time, you guys talk.
Morning. As the governor pointed out, the Joint Interagency Task Force is fully up and functioning. It is not just an interagency activity, but it's a whole of government and a whole of the state of West Virginia approach. So groups like the Long-Term Care Facility Hospital Association are involved. Yesterday, we had what we call a tabletop exercise to run through scenarios and address issues that we might have. We went through that. We briefed the governor later in the day on the results. We believe it was a productive event, and we continue to work through the processes we need to. As the governor pointed out, we estimate from what we've been receiving from CDC that Pfizer will send us somewhere between 16 and 20,000 doses initially, and then on a regular ongoing basis. We will wait to hear the total numbers from Moderna. Hopefully in the near future. We estimate that their EUA may be about a week or so behind. Hopefully it could change and go early. Priorities, as Governor pointed out, maintaining the integrity of our healthcare structure and system and getting our long-term care residents and staff. As we pointed out earlier this week, 47% of our deaths have come from nursing home and assisted living residents. So we want to aggressively go after and get those folks vaccinated to reduce that terrible loss of life. Other things that we will continue to be working, and again, I ask folks to be patient. This is a fluid operation. The numbers we receive daily change, as well as the dates. Estimated date right now of approval is the 15th of December. They have told us that within 24 hours, we'll begin receiving doses. Those will go to hub sites that we've identified. From there, will be broken down. And as Governor pointed out earlier in the week, the Pfizer vaccine has to be broken down from an original set of about 975. It has to be diluted and put into the appropriate format to put out. Another important point to point out today is that we have received our approval to continue our National Guard personnel through 31 March. We will then ask for an additional extension beyond that. And after the meeting with the governor yesterday, at his direction, based on our recommendation, we are going back to FEMA to ask for an increase in National Guard personnel, to put more personnel on duty because of the significance of getting this vaccine out as it comes in an efficient manner to take care of our citizens. Governor, I believe that's all I have at this point, and I'll turn it over to Dr. Marsh.
Okay, Doc. Yes, sir. Go, Doctor.
Okay. So I'll follow up on what the governor and General Hoyer have said. So this is really an incredibly optimistic turn for the COVID-19 pandemic. The two vaccines that we believe will be approved by the Federal Drug Administration are the Pfizer vaccine and the Moderna vaccine. First thing, just to re-emphasize, is these vaccines and the other vaccines that will come to market afterwards cannot cause COVID-19. So you cannot get infected by these vaccines. These vaccines, the two first ones, Moderna, I say Pfizer and Moderna, are made in a pretty unique way, but using a technology that's been developing for a decade or so. But basically what these vaccines do is they use a man-made genetic sequence of just a small part of the virus, the spike protein. And remember, the COVID-19 virus or coronavirus is called that because corona is like the sun. And remember when we were kids, we drew a center for the sun, and that's like the middle, the fatty part of the virus with those lines that go off. Those are the spike proteins in the virus. So those are the way that the virus connects with our human cells and infects us. And so what these vaccines do is they basically express only that spike protein. They're the genetic code just for that little part of the virus that gets then into our cells, and our cells make that protein and then instructs our immune system to respond to it. So there's no way we can be infected by the protein. The virus breaks down very quickly in cells, so it's really safe. As the governor said, these two vaccines have been tested, the Pfizer vaccine in over 40,000 people, the Moderna vaccine in over 30,000 people. They have met all their safety parameters. The Federal Drug Administration is looking at this using a special way to be able to rapidly approve these therapies as they're found and assessed to be safe, this emergency use authorization. But one of the reasons why the US is a little bit behind the United Kingdom in approving these vaccines is because they are basically using the same kind of methods that they would use in the general approval process that wouldn't be this emergency use authorization. So the FDA has taken extreme care in making sure these are safe, looking at all the data. And I know that for each West Virginian, that when it is time for you to be vaccinated, it is safe for you to be vaccinated. As the governor said, there's no tracking, there is no conspiracy over the vaccines. These vaccines are uniquely effective, over 94% effective. They block severe disease in older people, which is our real risk group, as the governor talked about with our nursing home population, General Hoyer did. And as we go forward, we know that we want to get every West Virginian the opportunity to get vaccinated. But as we start to mirror what the Centers for Disease Control's task force, their advisory committee on immunization practices, that basically said, let's protect the healthcare sector first, because as we've said, if we surge and we overrun the healthcare, the hospitals, then not only will people get sick and have problems and die of COVID-19, but they'll die of heart attacks and strokes and infection and other things that we take care of, cancer, that we take care of people in the hospital. So maintaining those vital functions is so important. And then getting to the group that dies the most rapidly and frequently from COVID-19, which is the nursing home population, and maintaining the structure, the capacity for our nursing homes, and then turning to the people that are first responders, people that maintain those vital functions in communities. So as we look at our plan, which the governor has really instructed us on, it's really maintaining those critical capacities, those services, the functions, but also save lives. And so we want each person to get their vaccine as soon as possible. But until that happens, we implore you again, as we saw yesterday in the United States, that more people died yesterday than have died at any time in the COVID pandemic, that we basically are approaching, we're almost exactly at the number of people that died in 9/11 that we saw die in one day yesterday from COVID-19. And we have over 100,000 Americans in hospitals. We see our state having a lot of red counties. So it is so important, each West Virginian, not only get the vaccination when it's your time and when you have that opportunity, but also protect yourself and protect each other. Use your power, wear your mask, stay physically distanced, be really, really careful being around a lot of other people, particularly indoors, particularly in places where people take off their mask, and be careful about being around other people that you don't live with all the time. Governor, I'll throw it back to you.
No, thank you, Doc, and thank you, General. You guys have been superstars beyond belief, and thank you so much. And I hope that even though it was long, I know there's a lot of people watching out there, and I hope that that clarified, maybe some worries or concerns or a lot of interest. But again, I remind you about your mask. Please wear your mask. It's the only defense and only bullet in the gun right now that we have, and I can't say enough about just that. It's the only thing I've got right now. And so if it's the only thing I've got, I'm going to surely try to use it and try to use it as best we possibly can. Wear your mask. Our testing over the holidays, if you, we still have testing sites all over the place that are available and everything. All this testing is free. It's painless. It just takes a little bit of time, and you've got the drive-through stuff at the pharmacies. Again, I thank Walgreens and Fruth for all they're doing. It's good stuff, but we got to continue to get tested like crazy, get more and more and more tests, the better, and everything. The more people we'll identify and know that are spreaders, and be able to cut this chain off that way. We now have 23 outbreaks in our schools, and we're down to 98 confirmed cases in our public schools. I've said it over and over and over. Really and truly, we've done an amazing job. All those that are working at this, all the service personnel, first and foremost, how they clean and how they really take care of the school and everything. How our National Guard runs to the fire and all the county health departments. And let's don't in any way, forget the front line. The front line are our teachers. And boy, what a job they're doing. It's unbelievable. I mean, really and true, our schools are safe places today. And we know how important it is to have our kids in school. As of today, our long-term care facilities, we have 113 outbreaks. We have 18 outbreaks in our churches in 14 counties. That's Berkeley, Braxton, Cabell, Fayette, Harrison, Jackson, Marion, Mineral, Mingo, Nicholas, Raleigh, Taylor, Wood, and Wyoming counties. We know that our churches are an area where this terrible killer loves to prey on us and everything, and so we got to be super careful there. A pew in between you, wear your mask, please. I sound like a broken record, I know, but just for the sake of saying it again and again and again, and if you can avoid, and you're of the age of 65 and up, please really consider, getting your church services online and maybe miss a few weeks. The vaccines are on the way. Let the Calvary that's on the way succeed in your life. Don't end up being a casualty. I mean, I hate to go through this, and this sounds terrible, but can you just imagine? And it's happened over and over and over. We've lost 799 West Virginians. Think about it. Think about how tragic it is to lose somebody. But think about lying there in that bed, in the hospital bed, gasping for your breath because you can't breathe. You can't breathe. And really and truly, you want so badly to be able to see your grandkids or see, your wife or whomever it may be, and they can't come and see you. Just think how tragic this killer is and the way it takes us away. So if you're of that age of 65 plus, please listen to me. Please, please, please take heed. On our corrections update, we have now 37 active inmate cases at Denmark. That's down from 58. There are now 6 inmate cases at Pruneytown and just 1 at Parkersburg. The Northern Correctional Facility and neighboring regional jail together have a total of 79 inmate cases there. We have a total in the state of 127 active inmate cases. That's down from 144 on Wednesday, and we have 67 staff cases. Corrections continues to do a phenomenal job. You just think of all the inmates, all the staff and everything. I think, and I could be wrong in this and everything, but I think we've lost 2 people to COVID. 2 people. Now, 2's too many, but really and truly, you've got to give our corrections people, DHHR, all of our health departments and everything, incredible work. Way to go. Our flu vaccines are out there and available. We encourage you to get them and get them quickly now. We absolutely encourage, I think if you're over the age of, I think it's 60, go get the larger dose but your doctors or the people administering it will surely know that. From the standpoint of our grants, now we have exceeded what we bucketed in the beginning of $201 million. In fact, we're right at $202 million. We bucketed 200. We increased that to 225. And really and truly, as we continue to get these applications in, even if we need to go a little higher than 225 to make sure that we get everything taken care of and everything, we're going to go to whatever it takes from our cities and our counties. From the standpoint of giving blood and plasma, you don't know how important that could possibly be. The Red Cross is pleading with everybody, especially those that are recovered from the COVID situation, to please come. Please come. I mean, just think about it. You have already been blessed beyond belief. You have recovered. You are blessed beyond belief. Why not take the time to be able to give blood and bless someone else? Please, come on. You have already received a blessing from God off the chart. Come on now, we need you. We really need you. Go give blood. Our general already announced this, but we pushed and everything, and our president has always responded, and now we have got the extension of our Title 32 order. I don't know if he mentioned exactly that, through the end of March. And so I want to sincerely again thank our president, President Trump, for this important action. I'll be sending a letter to the President requesting that the federal government continue to support the West Virginia National Guard in their response to this terrible COVID pandemic, and I'm sure they will. I'm sure they will. These men and women of the Guard have been phenomenal beyond belief. They're always phenomenal when it really boils right down to it. I've seen them wade in mud in the terrible floods. I've seen them in a terrible derecho when the windstorm came ripping through us. I've seen them over and over, you know, in what they've done in the RISE program and on and on. I have seen how they have absolutely run to the fire like you can't imagine in this COVID, this terrible pandemic. So with all that, to the men and women of the Guard, to our leader of the band, General Hoyer, and all those, thank you so much. Incredible, incredible work. No way we could ever repay it other than just tell you that we're standing arm in arm with you. We love you and we thank you and we really, truly appreciate you. That's all I got right now.
All right, thank you, Governor. Secretary Bill Crouch with the West Virginia DHHR and Dr. Ayn Amjad, our state health officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I know at the beginning of the week, we ask our hospitals and hospital systems to update their surge plans. Could you tell us a little bit about what we've heard from them and what they expect to see over the next 30 to 45 days?
Well, Charles, my input on that would be really brief, but I would say, you know, we asked the hospitals to, you know, we're nowhere close to panic situation as far as the number hospitalized, the ICU units and all that kind of stuff. We're not panic time right now, but we're really concerned time and we're planning time. And we asked our hospitals, you know, to do all they could, you know, from the standpoint of backing away on the elective surgeries that were overnight stays in the hospital, you know, because we surely don't want to overload our hospital systems in any way. But Dr. Marsh, you could talk about this better than anyone. I think our hospitals, you know, have stepped up and they're doing great stuff. But Dr. Marsh.
Thank you, Governor, and thank you, Charles. So we just had a conversation with our hospital leadership and the West Virginia Hospital Association this morning. As the governor said, the hospitals are still navigating these very rough waters successfully. The hospitals each have a plan to be able to enhance hospital bed capacity as need be, and the governor is spot on that the first parts of that plan are starting to reduce and holding off non-essential surgeries and procedures that require overnight stays, which opens up space. We talk quite a bit about staff as well, because as we know, the two equations of effective capacity to take care of people is the space, the bed, but also the skilled staff. And we still have people that have been infected and or who are quarantining in hospitals, but that has stabilized. We also have talked with the hospitals extensively about how we can work together to make sure that we're able to reapportion folks in the state as would need be to allow the hospitals, particularly the very high level acuity hospitals, the hospitals that have the most sophisticated capabilities in our state, to continue to operate. And while we're not at that point yet, we are doing a lot of planning and thinking and with the hospital CEOs and the hospital association. And that's particularly important because we know about 2 to 4 weeks after we see increases in the number of people that test positive for COVID, and we're up to about 1,000 people a day. And the Thanksgiving holiday is an area where more Americans traveled than any other time during the COVID pandemic. So we're particularly focusing on that potential next surge from that holiday and the holidays coming up for the hospitals. I hope that answered your question, Charles.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. Dr. Marsh just mentioned Thanksgiving. Yesterday, Governor DeWine and his health experts said we will just now, today, in the next few days, start to see the impacts of the Thanksgiving travel season. So with that in mind and seeing where we are now and what could possibly happen over the next couple of weeks, and then after, of course, the initial wave, usually 7 days later, as Dr. Marsh has mentioned, people start moving into hospitals and then eventually into ICU and eventually some on ventilators. How do you see the trend where we are right now, anticipating a little bit more of a surge over the next 2 to 3 weeks? And with all that in mind, do you foresee Governor maybe having to step in and do some of those targeted things you talked about earlier if we see significant surge numbers in different parts of the state? Thank you.
Doc, let me answer the back end first. Kenny, I've said over and over and over, we watch, we listen, we take into account every single aspect of everything. From the standpoint of where I'm at now, Kenny, this is everywhere. It's everywhere. If anyone can really tell me that shutting down, 18 hairdressers in a county or whatever is going to make a significant difference, I'm ready to move. But this situation is everywhere. And as we continue to do the very, very best we possibly can, from the standpoint of shutting the bars down, maybe shut down indoor dining, the things that we know about, they have to be on the table. They have to be absolutely on the table. I'm trying every way in the world not to do that, because the simple fact is just this. We don't have a situation like we had before in Mon County, where Mon County was red and the whole rest of the state, for all practical purposes, was green or yellow. We don't have that situation. We've got this like a polka dot all over the place, and we know if we just shut down something, we're going to lose people, we're going to lose, people's jobs, we're going to lose businesses, we're going to lose all kinds of stuff, and all the people we're going to do is drive across the county line. So it's a tough juggling act and everything. We're watching it, and we've got to keep everything on the table. And by everything, I mean just this, Kenny. At some point in time, and God forbid, if this thing continues and it gets worse and worse and worse, who knows what we'll have to do. But what we'll have to do is we'll have to do whatever it takes to be able to shut this thing down. Doc, you can answer the rest of it.
No, I think that, Kenny, your question is spot on. We recognize the potential for having increased demand on our hospitals, and that's why we're working so closely with a really talented group of CEOs of our hospital systems and physician leaders and state hospital association. So this morning's call, people felt like they were in better balance, and they were anticipating potential more activity, more demand on the beds. So they are ready. They have plenty of personal protective equipment, and again, they're getting their staffing in shape. The one thing, let me just also make a really quick comment about what the governor said, because I think it's really important. Any kind of mitigation strategy, whether that mitigation strategy is shutting down a bar or closing restaurants early, or, all the way up to stay-at-home orders, those are only temporary ways to try to settle down some of the activity. But if we as a state cannot come back with mitigating the virus, using our power on the virus constantly, then those efforts will only be temporary, and then we'll go right back to where we were. And so what the governor has said over and over again, and what we've said, which I know for some people is like a broken record, but the truth is we have such an immense amount of power with us today to start to reduce, cut down the chain, block the spread of the virus by simply, staying within your own family and not getting out among crowds and other people. But importantly, wear your mask and stay physically distanced. That is a real solution to this problem. And that is what we really encourage all West Virginians to do, whether or not the governor has to take any mitigation strategies like bars or restaurants or whatever, or whether some people have had the vaccine or not. We are really, really asking people in West Virginia to serve their neighbors, serve each other, serve the hospital system and the first responder by being really committed to wearing a mask and staying physically distanced. The next 2 to 3 months is going to be very, very challenging for many parts of our country. Let's not make that so in West Virginia. So thank you.
Thank you, Jordan. And Kenny, I again, just trying to jot down a couple notes. I may miss some stuff here and everything, but I want everyone to understand just this. It's not like we're just sitting here and wishing and hoping. It wasn't easy to just move in and say, we're going to move all the winter sports. All the winter sports are going to be moved until January the 11th, and I really, truly, in my heart, believe that we may have to move that date even again. All the travel ball, all this crazy travel ball that everybody's running around thinking that their child's going to be the next Michael Jordan and chasing these wild dreams in a lot of instances and everything. All the travel ball we shut down. From the standpoint of our state football playoffs, what happened there, and that went up in flames and everything. From the standpoint of moving the Thanksgiving holiday period to give us that 7-day period and still yet try to get our kids in school just a little while before we drifted off on a Christmas break. You see, I'm a real believer that those kids have to be in school, and eyes have got to be on those kids. It'd have been easy to say, okay, if we're off at Thanksgiving, let's just don't come back until after Christmas. A lot of kids would be hurt. A lot of kids would be hurt, especially our special needs kids, and especially all the problems that we're having with the virtual learning and everything else. Along the way, we put out an executive order on a mask mandate. The question that we ask and we continue to ask one another, and you should ask yourself, is just this, is what is the next thing we can do, other than sit here and plead with you to wear your mask? What is the next thing we can do that's really going to make a difference? Real difference. Now, we can do something symbolic just because somebody else is doing it, but when we do something symbolic, it's going to hurt somebody. Like I just said just a minute ago, we can close the hairdressers, or we can put, hours on the bars or whatever it may be in certain areas, or we can close them. People are going to move. This thing is all over the place. Where with Mon County before, we could target right to the source. Now it's everywhere. You need to ask, and not just Kenny, but Jim and everybody need to continually ask the question, what can we do mitigation-wise that is going to make a significant difference? Well, the only thing we can really do, in my opinion, mitigation-wise, is a wholesale shutdown. A wholesale shutdown. And the repercussions from that are enormous, way beyond belief, and we're nowhere close to being in that position today. But we've done a lot of stuff. And it wasn't easy, and we catch it in every way you can catch it nonstop. Well, by God, I think we ought to let our kids play travel ball, or this or that, or whatever it may be. For crying out loud, we need to first and foremost be worried about being in school. And next of all, sports behind that. And I'm a coach. I get it. I get every bit of this. But we ought to be wearing a mask, and we ought to be doing it. And I think in listening to these great experts and everything, you'll find one thing is perfectly clear. Everything's on the table. We're trying to do anything and everything we can that will make a difference until we get to the vaccine. All right, I'm done.
All right, thanks, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. You've answered a lot of questions already, but like Columbo, I have one more question. It is about the vaccine and whether it, if you already have the virus, say you're asymptomatic and you get the shot, does that make it worse, or does it act as a treatment to perhaps make it better, and perhaps that becomes a treatment down the line in a way for people that haven't gotten to the vaccine stage yet? Governor?
Dr. Amjad or Dr. Marsh, this is you guys. This is way, way out of my pay grade.
Do you want me to start, or do you want to go?
You can go first. That's okay.
So the current clinical trials for people in the Pfizer and the Moderna group did not keep people who had been diagnosed with COVID-19 out of the volunteer group. So at this point, we would recommend that everybody who would be at risk should get the vaccine. However, the same advisory group from the Centers for Disease Control that recommended the healthcare workers and nursing home residents and staff get vaccinated first may well modify that. And generally, the kind of vaccine that we give with the Pfizer and the Moderna vaccine do stimulate the immune response. So if people have had the infection before, they may get a more vigorous immune response, and therefore their arms might get sore in a greater amount during the first injection of the vaccine, or they could feel a little kind of not good for a bit afterwards. But in general, there shouldn't be any problem in doing that. The question is that really necessary? And that's something that the CDC will comment on in the future. Ayn, please.
The only other thing I'll add, Paul, is that it's most likely not a treatment. To the second part to your question, we don't believe it's going to be a treatment. It is a vaccine to prevent. However, unless we have some further studies down the line, I don't believe it addressed it as being a treatment option. It is a vaccine to prevent. Thank you.
All right, thank you, Paul. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, as we approach the federal deadline for spending CARES Act funding, I'm hoping for a couple of updates on specific categories. Could you give us an update on the $50 million allocation for broadband that was somewhat recently announced, and the $50 million allocation for medical access highways? Thank you.
Brad, on the 50 million on the medical access highways, you know, we're gathering in invoices and everything right now on that. That's going to balance out right on the money. From the standpoint of the broadband issue, you know, we settled out at about 33 million is all we could get out the door at this point in time and get spent and everything. And so, you know, I'm not sure where everything is flowing through the auditor's office, but that's in the broadband bucket. We're going to have to cut short of the 50 million and settle out, I think, at around 32 or 33 million. I don't know exactly the number and everything, but the medical access highways is going to come right in on the bucket of the 50 million. But you know, we continue to have update after update after update in regard to watching these CARES dollars and making it all balance out and everything. And like I said, we're on top of that in every way. The only thing that concerns me, and it concerns me the most, is just this: is, you know, we want to continue first and foremost, and we're going to. You'll see that especially in my state of the state. I am really, really committed to an all-out assault on the broadband issue. And really and truly, with the RDOF money and the $766 million that's coming into our state, and, you know, and Facebook and SAO and all the good work that they're doing, then absolutely what we are going to have to do within our state is to continue to make an all-out effort to finish up. And the thundercloud stuff down in Huntington and everything, broadband is the next new highway that this state needs a whole lot of catch up on. I am behind it 1,000% and everything. You know, we just couldn't quite fit all this into a bucket and move it fast enough right now before that December 30th cutoff. Now, but from the standpoint of the medical access highways, we're going to come in right on the 50. From the standpoint of the whole, there's only one concern. There's only one concern, and we're watching it, and we're watching it like crazy, and that's just this. These tests, the number of testing that we're doing is unbelievable. the cost of the testing is a big time number, and we're trying to monitor and get the invoices in and everything else to know exactly where we stand there. You know, how much is being paid by PIA or how much is being paid by, you know, Medicaid or private insurance or whatever, and how much the state's going to still need that CARES dollars for. We're trying to hold a little bit of money back and really monitor that, but that's, you know, that just gives you a little bit more insight into what we're doing. We're really watching it. I mean, we're watching it like crazy. That's why we've had to increase the dollars to our counties and our cities, because that 200 wouldn't quite cover it, and we moved it to 225, and it looks like, you know, that could even slide up as high as 235. But with all that being said, that's how we're doing it, and we're monitoring it. We're going to monitor it to the finish line, and we're going to run across the finish line with the product that we've set out to do.
All right, thanks, Brad. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. And first of all, Governor, I'd like to thank you, and I hope I'm speaking on behalf of everyone in West Virginia, for your kind words about Officer Cassie Johnson and that very thoughtful and heartfelt prayer you offered her and her family and the entire state. This community is just grief-stricken, and the words of comfort and kindness and appreciation mean a lot to all of us. On to my question now. The other day in the briefing, you broached the idea of possibly having to call a special session of the legislature if Congress does not act. And I don't have a crystal ball. Who knows what Congress is going to do? There's 3 bills floating around and they can't seem to agree on anything. What is your time frame for calling a special session? Because I can't imagine you could tiptoe up to December 31st and not have something in place. And so what time frame are you looking at? Next week or 2 weeks if you have to call a session?
You know, Mark, all I can tell you is just this. You know, we're going to watch it. We're really watching and dialed into this stimulus bills that are floating around and everything. And you know, let's just hope like crazy that we do not have to call a special session. But you know, in regard to, you know, how to bridge ourselves, you know, from a standpoint of if we get to year end and the Congress hadn't moved, how we bridge ourselves through the time gap that whatever it may be, you know, if it's weeks or a couple of months or whatever, we'll do whatever we got to do, and we'll do it, you know, there's a rumor that's gone around that we're going to have a special session on December the 10th. That's not true. You know, it's just, we're just watching it. We'll make the decision, and we'll give everyone plenty of time, but let's be hopeful that, you know, gracious, I just watch in total amazement. You know, that there's so many, and let me just take 1 second. Can you imagine the number of people that are out there that are really hurting? I mean, can you imagine the frustration and how tough it is on someone is trying to run a restaurant and keep people socially distanced and 50% capacity? And can you imagine how tough it is on somebody's bank account and somebody that's at their last end? A business maybe that's been there in West Virginia for 75 years. It's right on their last end. And they could just go down and not ever be able to recover. You know, can you imagine, you know, someone sitting and saying, life isn't worth living anymore? Can you imagine not being able to pay a utility bill and, you know, being unemployed and needing benefits and not knowing where you're going to go? Can you imagine sitting there with little kids and knowing just how nice it would be to be able to buy them presents for Christmas, and you're trying to hold back just enough money because if Congress doesn't act, there you sit. And absolutely, it is a shame. I can't say enough bad adjectives about how I think the people in Washington act and what they do. It is absolutely a political circus all the time, and I absolutely cannot tolerate it. That's all there is to it. People are really hurting, and yet we want to be able to get on TV and show our behinds and absolutely try to do the next political gotcha move to the other party. It's terrible. It's just plain terrible. So, Mark, we're going to watch it. And, if we need to have a special session, we'll have it. We'll have it in plenty of time. You got a lot of really good people within the legislature that we're working together and working hard to get through all this, and we're going to keep at it.
All right, thanks, Mark. Next to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. Dave Mistich here. My question is related to the president-elect, Joe Biden. He said just the other day that in his first 100 days in office, he's going to call for 100 days of wearing a mask. We've been told, I believe our own experts here in the state have said that, the vaccine itself is not enough. We're going to need mask wearing to continue. My question for you, Governor, is would you endorse the president-elect's initiative for 100 days of wearing a mask once he's sworn in?
And this was Matt, is it? Dave, I'm sorry, Dave. Dave, let me just say this, and this isn't a dodge of the question. In all honesty, I'm sure that the vice president, the president-elect, I'm sure that his intentions, as he is sworn in, and I guess there is still some question if that's going to become a reality. It surely looks like it is and everything, and I want to be super respectful to him and his running mate, the vice president-to-be, Vice President Harris, and I'm sure he's trying with all in him to do exactly what he knows we're going to probably have to do. If we take on the challenge to vaccinate a nation, it's just common sense that we're probably going to have to continue to wear our mask and wash our hands and do those social distancing things for a few months until we get to the finish line. I'm always saying to my ball teams and everything else, and I say it to my kids all the time, run through the finish line. Don't jog through the finish line, run through the finish line. And in this situation, I think that's what, Vice President Biden is doing. I think he is absolutely telling us all that we absolutely need to be prepared to wear our mask. I think that could very well change, and what I'm saying is we could have some level of real successes that really and truly that mask wearing mandate or whatever, would drop off, sometime 30 days or whatever short. I mean, how could you be doing anything that would be wrong to say, I'm absolutely very supportive. I want our president to be, successful beyond belief. And with all that, if it takes wearing masks for 100 days to get us across the finish line, who wouldn't be? Who in their right mind wouldn't be supportive? But the good part about it is just this, and this is exactly what I think will happen. I think at the end of the day, we will start getting the vaccine, and our level of success in breaking this chain will be so dramatic that the need for wearing masks will diminish and diminish quickly. The last thing I'd say, Dave, is just this, and I can say it in one sentence. If you were just going to be doom and gloom, and you were just going to say, dag, we're going to end up having to wear a mask for 2 years, and this thing really isn't going to work, and I don't necessarily believe in taking a vaccine, then what you really need to do, you just need to go to the house and just give up. Well, I'm not going to do that. I'm not going to do that. I'm going to stay positive, and I'm going to stay hopeful, and I'm going to stay engaged, and that's why it may very well be that we end up wearing the mask for 200 days, but I really don't think we're going to have to wear a mask 100 days. So anyway, I hope that answered it.
All right, thanks, Dave. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, as you and Dr. Marsh have mentioned, there seems to be some reluctance on certain parts of West Virginia, certain West Virginians to get the vaccination. Is there going to be any PR campaign or publicity effort to try to encourage everyone to be vaccinated?
You know, I think General Hoyer can talk about this, but I really don't know that we need General Hoyer on this. I can do this. We're going to do a significant campaign, and that campaign is not going to be a sales type campaign. We're not going to try to sell the people of West Virginia anything. You know, really and truly, what we're going to try to do is educate the people of West Virginia to where they truly know exactly how the vaccine works and how what the dangers are and everything of taking the vaccine, which so far from what we can see are extremely, extremely minimal. And we're going to educate. I don't want to sell West Virginia anything. You know, I mean, at the end of the day, West Virginians are too smart for that, and they're going to make good decisions. But absolutely, there are a group of people that would be hesitant. You know, there's always people that are hesitant, you know, and everything. And you know, we'll be fine with that.
All right, thanks, Phil. Next to David Beard with the Dominion Post.
Hi, I'd like to ask about the Vault Health in-home COVID test. Vault says on its website that it reports the results as required to the state. And I wondered how they do that. Do they report that just to DHHR, and does DHHR then disperse the information to the county health departments, or does Vault report that to each county? And then when the results come in from the Vault tests, how do you set up contact tracing on those if the person is positive? Thanks.
David, I'm gonna pass to Secretary Crouch, but I'm gonna say this before I pass. The concern I have is just real simple. You know, the cost of this test is higher than the cost of our other tests, almost double. You know, the reliability of this test is still questionable. You know, I'm sure Secretary Crouch is watching this, and probably we're going to have to you know, feel our way, get some level of test runs and everything, and they can talk about the contact tracing and everything. But you know, I'm not a wholesale buyer of where we are in this home care stuff. But anyway, or you know, Secretary Crouch, maybe you could jump in.
Yes, Governor, thank you. Thank you, David, for the question. These tests are PCR tests, as our other most of our other tests are. They go straight electronically through the system to the local health department and to the Bureau of Public Health and DHHR. So we have the same response time from the time those tests get to the lab itself. The turnaround time is seen as very good right now. So as the governor said, we're monitoring this closely. We're looking carefully at the utilization of this. We're comparing prices as we go along. We have a lot of different prices, a broad price range with regard to the labs we have right now. We have close to 20 labs in West Virginia that we're dealing with. So as the governor said, we're watching this. We're going to keep a close eye on it and make changes as needed as we go down the road. But the results of the tests come through just as they do with other tests in West Virginia.
All right, thank you, David. Next to Lindsay Renner-Wood with the Cumberland News-Times. I believe you may be on mute,
Hi.
Lindsay. There we go.
Hi there.
We hear you
Sorry
now.
about that. Thank you for having my question. So on the subject of the additional public health measures that had previously been discussed being enacted in counties where the virus is currently at its worst, I was hoping that you could explain a little bit further how you arrived at the decision not to proceed with any additional restrictions in the interim until the vaccine can be widely distributed. I'm thinking of Mineral County specifically, where they've seen some of the worst numbers in the state, if not the worst, for about 2 weeks straight now. They keep seeing these large spikes, sometimes more than 200 people per 100,000 for the infection rate at points. So, and I know other counties are starting to enter the red and see similarly large spikes. And I'd like to know if you all can provide a bit more insight into that decision to not enact any further county-specific measures ahead of the vaccine distribution. Thank you.
Okay, Lindsay, I think I can take this. I think I can answer a little bit of this and everything, but you know, I think what we found in Mineral County, I know, was we've checked with our ABCA, and through all that and everything, what they've given us is just this, that the problem that we first thought, okay, we shut down the bars. You know, that was the first reaction and everything. Then we found out really through all the tracing and everything that the problems weren't really coming from the bars like they were really in the Morgantown area before and what happened before. But the problems were really coming from nursing homes, you know, and that was you know, a completely different issue. But again, Lindsay, I just tell you just this, good gracious, we're processing all kinds of information nonstop, and it may very well be that, you know, tomorrow or Monday, you know, I come out and I say, listen, we're going to have to do this and this and this in these counties and everything upon the guidance of all the experts and everything. But there has been, you know, a tracing, you know, I think in Mineral County to a public gathering and different things like that. But nevertheless, you know, I guess the net of the whole thing, the way where I'm at is, Lindsay, look at what Mineral County is and look at how far it is to move out of that county. If you were to close something, close bars, whatever, people are just going to move right across the county lines and everything. It is absolutely, you know, oh so true that these public gatherings statewide are really just, you know, getting us. The nursing home situation is getting us. We try to really look at whether or not we should react to the bar situation in Mineral County and everything else. But we're trying, again, I just say it over and over, anybody that can bring me something that says closing this will significantly turn the dial, I close it in a second. That's all there is to it, you know. But if it's going to be insignificant or we don't know and everything, we know there are consequences to closing any and everything. And so we're trying, like I said, over and over to bounce and keep the balls all moving in the right direction.
All right, thanks, Lindsay. Next to Amanda Mueller with WBOY.
Hi, Governor. We've talked so much about people social distancing and avoiding large crowds. And right now in our part of the state, particularly in Harrison County, there's some controversy over a homecoming dance that was held for students under the guise of a vow renewal at a private event center. And we're told there were possibly hundreds of people that were at the very least invited to this event. So we are wondering what you would possibly say to people who are using these loopholes to continue to hold these large events and the event venues that are allowing it to happen. And then also we'd like to hear from the health experts about effects that events like this could have on spreading the virus.
Okay, let me jump in and just say this. We can't believe the police force to everybody all across the state. For crying out loud, what you're speaking of is exactly what we should not be doing. Exactly what we should not be doing. Just think about this. I got wind of this like, I don't know, 2 days ago and everything. But I got wind of the fact that in Raleigh County or maybe Fayette County and everything, there was an organizer that was putting together some, you know, and I always called it midget football, but some, you know, smaller league type football. And there was 20 to who knows how many teams coming to an event from all over who knows where, coming to an event that they were going to have, and they were calling it their league playoffs. I mean, are you kidding me? Are you kidding me? You know, and we found out about it, and we absolutely just shut it down. You know, but absolutely, you know, we're trying, you know, we still have people that are are gaming the system, and they're taking kids out of state, and they think, well, you know, here's what we can do. We can go to a tournament in Asheville, North Carolina, and we can go down there and play because they're allowing us to play. But the problem is they're going to come home, aren't they? You know, they may run into all kinds of issues there. You know, we've got to be on our game better than this. We can't be, you know, the governor can't be the police force for everybody. But for crying out loud, we see it. We see it every day. And so what you're describing there is exactly what the problem is. Now, you asked for something from the healthcare people and everything. Guys, if y'all picked up on that, you know, please share with them what you know, the lady asked for.
We get multiple calls like that throughout the day, and if not the week. Those are events that we're concerned about. That they can spread COVID-19, and we don't recommend them. It's hard for us to address them if they're held on private property. We do try to call several of those places and encourage them not to be held, but it is difficult when they're held on private property. But we do not encourage people to hold large events like that at all. But it's very difficult to address them, but we don't recommend them at all. Thanks.
All right, thank you, Amanda. Next to Evan Bevins with the Parkersburg News and Sentinel.
Thank you. Wanted to ask, you were talking about the increase in the number of tests. I know we've had demand increase here in Wood County. How is that impacting the Guard's ability to assist the health departments with staffing? And do you think the availability of the home tests will alleviate that at all?
All right, let me go again, guys, just from the standpoint of trying to get all the questioners here and get just really quickly. The Guard is going to have to pivot from the standpoint of, and we just had this discussion yesterday, the Guard's going to have to significantly pivot to the administration of all this vaccine. From the standpoint of testing, they'll still be there to be able to assist and help us with testing, but the Guard is going to move significantly toward the vaccine side. We want to continue to test as much as we possibly can. My skepticism about the in-home test is just the reliability, and from the standpoint of in this test thing, in this test game, just to tell it like it is, you know, you got a lot of people out there that are testing, and the dollars are flying around like nobody's business, and you know, it just seems outrageous to me, the cost of the testing. But with all that, we've got to be able to balance out the economics of the testing and everything. Our Guard working on the vaccine, and still, you know, still being able to run to the fire and help us all over the place that they do, you know. But the home testing may be of some real benefit to us. But we're just watching that, and we're going to, you know, I'll defer to all the experts on that. But that's the long and the short of the question.
All right, thank you, Evan. Last question today from Sean Stinson with the Pendleton Times.
Thank you, Governor. I actually have two questions that are in regards to the county map. The first one actually comes from our health officer here in the county, and she sent me an email that said Pendleton County went into the red in the infection rate yesterday as well as today, but the color map is still green. She says people are not taking the increase in the infection rate seriously because the map isn't changing. The infection rate is on the table on the DHHR map, but people aren't necessarily drilling down for the real numbers. And how can the dashboard and the map help us get out the real story? And the second part of the question is in regards, this is actually for Secretary Crouch. I saw in regards to the cumulative data in the county that you could see the cumulative each case. But when I was going through that, I saw that there was some personal information that could possibly identify who each case was. So I contacted my health department to say, why is that there? I think you can almost guess who some people were. And so she contacted someone higher up to get that redacted. However, that entire field has now been removed from that site. And I sent an email to Allison Adler to see if that information was going to come back, and she said that it was not. And Secretary Kosh, I was hoping that you would be able to put that information back up. That's just cumulative, but redacting all the personal information. That's all I have. Thank you.
Let me just say this, that and I want Dr. Marsh, you jump in and talk about Pendleton County from the standpoint of I'm sure the positivity percentage keeps them in the green, and the infection rate, it's not a big county. If we just had purely the infection rate, it would go instantly in the red. That's the one thing we don't want to do, is take a county that is a rural county and absolutely take just a spot of positive that we had and not a great big number, and it jumped the whole county into a red situation and everything. And it's not fair to all the county and all that issue. And the only other thing I would say is just this, I would say it to the media, the health officers and everything. There's always going to be something. I mean, for crying out loud, there's something out there somewhere and everything else, that somebody's doing or taking, that this is, taken out of text or whatever like that. But I'll promise you this, that my goodness gracious, and I am not looking for anybody to cry on my shoulder or me cry on their shoulder. I absolutely know how difficult this is and how great the work is, and there is always something. I go back to Clark Griswold standing in front of his house, and he worked so long to get those crazy lights up all over his roof. And I think then his dad looked and said, the light on the third row's not twinkling, and he looked at him, like, are you kidding me? And then he said, thanks, Dad, for noticing, but there's surely need for us to bring up anything and everything. We love the input, and then we try to fix it and everything. But believe me, B, there's a whole lot of lights not twinkling and a lot of time here that we got to run to and try to get fixed. But Dr. Marsh, maybe you could take over on the infection and the positivity percentage.
I appreciate the question. The governor is correct, in my opinion, that there's no perfect structure. Just as a real quick reminder, when we went to the infection rate or the incidence rate only, then we saw counties drop their testing, and we were below 2,000 or below 3,000 tests a day. Right now, I think we're about 12,000 tests a day. So in order to keep West Virginia, as good as it can possibly be, save lives, improve outcomes in communities, help kids go to school, we added the percent positive rate, which then gave counties the opportunity, by enhancing their testing, to identify people that could spread and to try to continue to identify people who are sick and not penalize them for that. And that has been, in my opinion, really effective. As we talked throughout this process, the thought that we have had has been that if you're successfully mitigating, if you're successfully dealing with the virus, stopping its spread, then initially as you test more, that infection rate will go up as you identify more positive people. But as you get the virus under control, that infection rate will start to go down. I think what the question really underscores, and we've been talking about this now for the last month or so, is that the infection rates continue to stay up, and in some cases are going up even further, which says that we have not really stopped the spread of COVID-19 in any county. So no matter what your percent positive rate is, if it's green or yellow or gold, as your infection rate is in the red, it tells you that you still have community spread. And the higher it's in the red, the more community spread you still have. By continuing to test, we are trying to keep the county active, keep it as safe as it can be, but it should not mislead people to think that it's safe not to wear a mask and not to distance, because in fact, as the governor said, half of our state now is in the red or the orange if you look at the color-coded map. And it just tells you, as we see in the country with over 200,000 people testing positive on a daily basis now, first time in the pandemic's history, over 100,000 people in hospitals now, more than any time during the pandemic's history, and more people that died yesterday than any other single day in the pandemic's history, that we don't have control of this pandemic anywhere in the country. But that's why West Virginia has a great opportunity to continue to demonstrate how to do this. So I hope that answered the question.
All right, thank you, Sean. Governor, I'll turn it back to you.
Well, we've reported a lot to you today, and I hope that everyone is still on, embraces the information, reacts to the information. I said early on, and I'll read this again to you. From time to time I do this, but not very often, but I said this early on, and this goes back now. It's almost a year, but I said it's not time to panic. It's time to be cautious. It's not time to be fearful. It's time to be smart. It's not time to be weak. It's time to be West Virginia strong. It was right then. It's right today. This is what we have to do. It's not time to panic. It's time to be cautious. It's not time to be fearful. It's time to be smart. It's not time to be weak. It's time to be West Virginia strong. Now, let me close by just saying just this. We try to remember 799 folks that we've lost in West Virginia, and it's tough. We absolutely try to remember Cassie Johnson and her family. What a tragedy beyond belief. Absolutely, we absolutely have to continue to do everything we can to buckle down and stay together, West Virginia. There are those that are going to stand out there and say, well, by God, I ain't wearing a mask. And really and truly, there are those that, would say, by God, you should wear a mask, or by God, I am wearing a mask. At the end of the day, we do not need to be separated from one another at all. We have got to get through this together. We are close. We are really close to that vaccine. And absolutely, let's try to do with all in us to respect each other's opinion and to get through this together. That's what we've done thus far, West Virginia. And that's what we've got to do to get through this. If we fragment into all kinds of different directions, absolutely it will become a dog's mess. That's all there is to it. Now, we're going to get there. I hope to goodness that everybody will understand that a public gathering is about the dumbest thing that we could possibly do at this time. We're not a police force here. We absolutely need to make it perfectly clear, where people are constantly looking for a little loophole in the whole deal and everything. Have we not ended our fall sports? I mean, for crying out loud, have we not ended our fall sports? And then to say, well, you said we're going to not do our winter sports until January the 11th, but we can continue to do our fall sports till where it freezes over. I mean, come on. Come on. Let's just be reasonable. Let's absolutely do what we have to do with all in us to get through this. We are dealing with people dying. We are dealing with kids not being in school. And we're dealing with people at home that don't have a job. And we're dealing with people losing their businesses. And who knows what all else. We've absolutely got to buckle up and buckle up together. We're going to get there. Stay on your toes, West Virginia. Thank you.